and welcome to the program Newsroom series, and this edition covers Nigeria's Northeast. I am Bukola Koka, and we begin first with the top story. The Special Advisor on Media and Publicity to President Bola Tinubu, Mr. Juri Ngelale, has taken a break from his position to attend to medical matters presently affecting his immediate and nuclear family. In a personal statement he released, he stated that he has submitted a memo to the Chief of Staff to the President that he is taking an indefinite leave of absence to address what he describes as a vexatious medical situation that has worsened at home. He said this leave also applies to his positions as the official spokesperson to the President, the Special Presidential Envoy on Climate Action, and the Chairman Presidential Steering Committee on Project Evergreen. The Special Advisor says he is looking forward to returning to full-time national service when time, healing, and fate permit, and respectfully asks for some privacy during this time. The Benue state government has sealed Oracle Business and its subsidiaries for alleged tax evasion to the tune of 130 million naira in the last 5 years, alongside Jiangsu Oil and Petrol Plant, all in Makurdi, the Benue state capital. Addressing journalists on the enforcement exercise, the acting executive chairman of the Benue State Board of Internal Revenue, Mr. Sunday Odagba, says the exercise was purely to recover tax income from all corporate entities owing the state government. He denies the allegation of political persecution raised by the management of Oracle Business Limited. The group managing director of the company, Mr. Mike Omniyi, alleged that the 130 million naira tax liability was just a ploy to shut down his production lines, as the money was reviewed to 38 million naira, which the company paid. Residents of resettled communities in Gwaza local government area say intimidation and harassment by Boko Haram terrorists have stalled farming and agricultural activities, which have in turn led to a drastic increase in hunger among them. The inhabitants of Ngoshe, Warabe, and Wala communities, during a visit by leaders and stakeholders of Gwaza, say hunger is at its highest level because Boko Haram insurgents hibernating in the Mandara Mountains are terrorizing farmers and farmlands.
Ngoshe is 35 kilometers from Gwaza town, located at the base of the Mandara Mountains along the border between Nigeria and Cameroon. It is also considered a hideout for Boko Haram insurgents. Warabe and Wala communities are located about the same area on the Nigerian side. The residents of these communities are former internally displaced persons resettled by the Zulum administration. They are predominantly farmers but have no access to the farmlands owing to the activities of the insurgents.
Firstly, we the people of Ngoshe, if you look at our faces, we are hungry. What I'm saying is no fluke, it's the truth. Secondly, we do not have drugs, no hospital. Ordinary headache, we cannot get drugs. It is the soldiers that are providing for us, no doctors. Thirdly, we want our community to be extended so that we can have enough farmlands to cultivate. We want the soldiers to adjust their boundary further.
Located along the Maiduguri-Madagali Road in Adamawa and between Mandara and Sambisa Forest, Warabe and Wala communities are sometimes described as a meeting point for Boko Haram terrorists in Sambisa and the mountains. However, it looks like the narrative about this area and its residents is about to change. In the bid to curb the activities of the insurgents, Professor Babagana Zulum's administration directed the construction of 500 housing units in Wala community, which has been deserted for years.
This 500 housing units is going to show a serious impact to the development, especially those areas. Some are residing in this, some are residing in this community. Some have not gotten resident here. As a result of this one, now when it's been completed, some from here will move to that place. Some from the Goza camp, that is within the GSS Goza still, they can come and occupy that place.
The leaders of these communities praised the efforts of the Nigerian military and the government for for the improved security and other social services being rendered.
The person defending people in Goshen now is from, and he's putting all his life there. He's giving them all the support. You could hear that yesterday his complaint was that he needed medical support because the army doctor in Goshen is the one, treating our people in Goshen. And you can see what their only problem is. They even want Goshen to be expanded. But farming activities is going under strict supervision of the military picketing from morning till 6 in the evening before they pull out.
According to them, the reconstruction of Wala and Warabe communities will not only improve security along the axis, but will also boost socio-economic activities along the busy Maiduguri-Gwoza to Madagali Federal Road.
The governor of Bauchi State, Mr. Bala Mohammed, has expressed his vision to make the state financially self-sustaining and less reliant on federal support. While advocating for a restructuring that would allow states to achieve financial independence and contribute to the federal government, Governor Mohammed emphasizes that his administration is guided by a clear vision and plan. He also highlights his administration's achievements and commitment to further development before the end of his tenure. He made these remarks while receiving the Diamond Award for Excellence in Service Delivery from the Nigerian Institute of Public Relations.
We have done a lot in education, in health, in infrastructure, in human capital development, but we have just built schools, hospitals, clinics without the required human capital. And we need to do more in that respect. We need to open frontiers and partnership with the international global partners, with the federal government. I don't allow myself to be retarded by being in the opposition. I must take the right of the people of Bauchi within the committee of states and within the national arrangement. The federation is a beautiful arrangement. We need to structure it so that each and every federating entity will contribute positively to the center. There shouldn't be any parasitic people sitting and thinking that there will be manna from heaven. We must respect ourselves. We have so much intellect and potential that we have not tapped. Mr. President and members, my vision is to make Nigeria or Bauchi self-sustaining, financially independent, and capable of sustaining itself with or without the federation account, and even contributing operational surplus to the federal government. And we have the capacity to do it. We are establishing a cement factory that will produce 10 million metric tons of cement, and we are part of the ecosystem.
Traditional rulers in Taraba State are alleging that they have been marginalized and denied their rights by local government council authorities for decades. The chairman, Taraba State Council of Traditional Rulers, Ishaku Ada Ali, disclosed this at a meeting between council members and the Taraba State Advisory Committee on Local Government Autonomy. The traditional rulers are hopeful that the recent Supreme Court ruling on local government autonomy will restore the lost glory of traditional institutions in Nigeria.
The Local Government Autonomy Advisory Committee in Taraba State has taken its sensitization exercise to southern and northern zones of the state as it seeks to create a comprehensive roadmap for the full implementation of local government autonomy. Their first port of call is the palace of the Akuka in Wukari Local Council, where traditional rulers of the zone converged to lend their voices to the issue of autonomy, which they believe will improve the lives of the people. Chairman of the Taraba Council of Chiefs, who speaks on behalf of others, says the verdict of the Supreme Court is timely, as it will save traditional institutions from the embarrassment of being subdued by local government authorities, which has been happening for decades.
The issue at hand you brought to discuss with us is enormously important to us, for which we hope we will iron everything one after another. And the issue is timely because the Traditional Council suffered a lot in the hand of the local government, the past local governments. We don't want such thing to happen again. I think that is why His Excellency decided to set up the committee to set it right. We're happy. We're coming.
Former Speaker of the Taraba State House of Assembly, who chairs the Advisory Committee on LG Autonomy, allays the fears of subjugation, given further reassurance that autonomy will allow them play pivotal developmental roles.
We recognize the critical importance of preserving and strengthening the traditional dispute resolution mechanism that have served over the communities for generations. The local government will be encouraged to work together with the traditional institution to uphold the rule of law, maintain social cohesion, and foster a culture of peaceful coexistence. Moreover, the security of the lives and properties of our citizens largely lies within the spheres of our traditional rulers, which call for synergy with the various councils to checkmate the activities of the criminal-minded ones in the society.
The committee members moved to the northern zone of the state, where other traditional rulers gathered at the palace of the Emir of Muri, where chairman of the committee reiterates that all hands are on deck to ensure that the revered position of traditional institutions is kept intact and the gap between them and the residents closed.
Your role as the interface between the government and the grassroots will be amplified, ensuring that the policy, programs, and decisions made at the local government level are truly reflective of the unique challenges and opportunities faced by each community.
Traditional rulers describe the gesture to consult them for a way forward as unique.
It has been a very gracious opportunity given to the royal fathers of the state. And that was done because the governor himself has a passion on the existence and value of traditional rulers.
The state government promises to continue to engage all relevant stakeholders to address grey areas and any loophole before implementing the local government autonomy.
As floodwaters continue to cause havoc in Nigerian communities, a civil society organization, Taimako Community Development Initiative, in partnership with the Yobe state government, has engaged 100 youths to evacuate drainages in Damaturu, the state capital. The program officer, Aisha Seidu Daya, explains that the exercise, which will last for about 6 months, is to control flood, avert an outbreak of disease, and create jobs among the youth.
It's a creative in our implementation to see how we can take our measures against this flooding that's occurring here in Yobe State. And also apart from this, it also created an empowerment to our youths in the states. So through this, we promoted awareness as well. We are distributing hygiene kits, and also we'll be going like the places that this thing have been conducted for supervision to see if there is any need for conducting this activity again in that area. So through this, we hope that it will not only build resilience, but also fostering initiatives that will prevent this disaster that is occurring in our states. And we are also looking forward to our government to collaborate with them to see if we can expand our targets.
You're watching Newsroom Series Northeast, and still to come, the government in collaboration with Save the Children International trains 48 frontline doctors and nurses on comprehensive health. We have details of this story and more coming your way after the break. Join us again. Welcome back. There's more from Yobe State as the government, in collaboration with Save the Children International, has trained 48 frontline doctors and nurses on essential and comprehensive newborn care in the state. The training, which lasted for weeks, was aimed at equipping and updating the knowledge and skills of the workers on early identification and management of newborn common complication, essential newborn care, and newborn resuscitation.
A According to the Nigeria Demographic and Health Survey 2018, 39 out of 1,000 live births in the country result in death within the first 28 days of life, owing to poor care. Yobe State government is aligning with Save the Children International to change the narrative through a child survival action plan to improve the quality care for newborns. The collaboration involves the training of 48 frontline doctors and nurses on essential and comprehensive newborn care. This includes updating the skills of workers on early identification and management of common complications, essential newborn care and resuscitation.
In collaboration with the Federal Ministry of Health, we have completed both essential and comprehensive newborn care course, ENCC and CNCC, for 48 frontline nurses and doctors at the state specialist and teaching hospitals in Damaturu. The frontline health workers are now equipped with updated knowledge and skills for early identification and management of newborn common complications, essential newborn care, and newborn resuscitation with a family-centered care approach to accelerate reduction in neonatal mortality.
Yobe State Commissioner for Health, Dr. Lawan Ghana, says the state government has established intensive care units across all public health facilities over the last 4 years to reduce mortality.
This phase is like an expansion phase, which the organization Save the Children International has supported the state with the necessary equipment at the teaching hospital and the specialist hospital here in Damaturu. And of course, it is also coupled with the training of the healthcare workers.
Meanwhile, the Yobe State University Teaching Hospital gives assurances of the commencement of full-scale pediatric services.
For us at the Yobe State University Teaching Hospital, I want to assure you that very soon we're going to start full-scale pediatric services as well as obstetrics and gynecology to complement each other.
Some of those in attendance seek knowledge transfer from the trainees to other colleagues.
I want to urge you all, as you go back to your various facilities, we implore you that you step down these trainings to your colleagues that are not here. You'll be able to do that. I know and I trust that you can do it, isn't it? Yes. So you have to be committed in doing that.
The only thing that we need from you is passion, dedication, then training and retraining. You have gotten the requisite training. You have to downstep this training to the people that you're working with. Because when you have a knowledge and then you just keep it to yourself, then it's not going to be helpful to the society. So we want you to show that, commitment. We want you to be champions that she has already mentioned.
With the establishment of about 150 primary healthcare centers across the state, it is hoped that the indices of child mortality in Yobe would be reduced.
There's more on healthcare as the Gombe State Contributory Healthcare Management Agency, Go Health, is giving Alamajiri children in the state a clean bill of health by enrolling 1,000 of them in its equity program and is also providing them with identification cards to enable them enjoy access to free medical care. Through the equity program financed by the Basic Healthcare Provision Fund, Go Health says it plans to expand its tentacles to give free health insurance coverage to orphans, internally displaced persons, widows, and other vulnerable persons. The Gombe State government is rewriting the story of the Alamajiri children by launching a set of campaigns towards taking them off the streets and providing a conducive learning environment for them. The latest efforts of the state government is the provision of access to good medical care through the Gombe State Healthcare Management Agency, Go Health, which has enrolled 1,000 Alamajiri children.
Health, as you know, is something that can be transmitted, although not all diseases are transmittable. If we claim to be healthy, like I said, and the Almajiris who sometimes use their services in the house are not healthy, we can still contact them. At any rate, even if it's not Almajiris, if all of us are not well, then you are still not well, because the other person can transmit it inside. So we have decided to go down to the ladder, those that we believe cannot afford it. So, in fact, we were supposed to have started with them, because some of us can afford it. But since they cannot afford it, we are supposed to have started. But it's not late, and that is what we are counting.
With new hospitals being built across local government areas, the State Commissioner for Health, Dr. Habu Dahiru, says the state government has transformed the health sector within a short period.
I truly feel excited that we're able to implement the vision and mission of His Excellency the Governor Muhammadu Inuahia. When he first came in, he made a promise that we are going to rehabilitate and take off this Almajiri off the street, establish formal school, provide them with numeracy and literacy, and then integrate it with provision of good nutrition and health care. Now today, with the introduction of Go Health into their program, meaning registering them to have access to health facility and receive care.
For the Education Commissioner, Professor Aishatu Megari, the enrollment of Almajiri into the health insurance scheme justifies her ministry's efforts to take education to the next level.
This will go in a long way in our RTC model, the retention, transition and completion model of our schools, because a healthy child is a child that will be retained in school, will have the capacity to learn very well. And then with our mega schools, megas and girls schools, 3, one in each senatorial district, our bilingual schools, 3, one in each senatorial district, and our 11s and girls schools, 1 in each of the local government areas, and some even having 2 or more than 2 even. You see, when we enroll them, we put them back in school, already there's a health care provision for them, because when they are healthy, they will go to school.
Meanwhile, the executive secretary of the agency reveals more benefits of the health insurance scheme for vulnerable persons in Gombe State.
Today marks another milestone in our journey towards the attainment of universal health coverage in Gombe State. I'm glad to report that His Excellency, Governor Muhammadu Inuahia, has released the state counterpart for the Basic Healthcare Provision Fund for the year 2024, and has equally directed the release of the Equity Fund for the equity program in Gombe State. And he specifically directed that we should identify all key vulnerable populations in our communities and ensure that we reach out to them and enroll them into this equity program. Today, we have started with the Almajiri children, and inshallah, in the coming weeks, we are going to the orphanages, and then we'll reach out to other key, vulnerable populations in the nooks and crannies of Gombe State.
The Gombe State government is confident that this healthcare initiative will improve the well-being of residents and promote healthier communities. And to other aspects of development now, Nigeria's Minister of Water Resources and Sanitation, Professor Joseph Utsev, has visited the Dadinkowa Dam in Gombe State, which has in recent times been a subject of controversy. The minister is accompanied by his Minister of State and other top officials of the Ministry of Water Resources and Sanitation, and their visit is for an on-the-spot assessment of the facility, which serves millions of people in the northeast sub-region and the country as a whole.
The Minister of Water Resources and Sanitation, Joseph Utsev, is visiting the Dadinkowa Dam in Gombe State following a disturbing story published via a newspaper medium, claiming that the Dadinkowa Dam was on the verge of collapse due to excess flooding that had ravaged communities and killed close to 200 people. After taking a tour of the entire facility, he expresses satisfaction that all the components of the dam are in perfect working conditions and cautions non-professionals to desist from spreading unsubstantiated stories. He describes the decades-old dam as a critical national asset, as it houses a 40 megawatts hydroelectric plant that contributes to the national grid, serves as a source of irrigation for farms, and provides Gombe Township's water treatment project with millions of liters of water daily.
I want to assure the public that the facility is in safe hands. It has international standards and it's very safe. safe in terms of its operations, safe in terms of its structural maintenance, and safe in terms of even the security. As you can see, we have security on ground, and in terms of its functionality, it is very, very safe. What you are seeing here is the normal function of a dam. The water that is spilling out is coming out normally as it's supposed to come out. So there is no flooding in Dadinkowa Dam. Everything is under control and is servicing Nigerians and servicing at optimal level as it's supposed to work.
Mr. Utsev is accompanied on this trip by the Minister of State for Water Resources and Sanitation, Mr. Bello Goronyo, who says this inspection by top brass of the ministry is to allay the fears incited on account of the false story.
When the news came, we didn't wait for anybody to tell us what to do. And we didn't sit at our comfort zone to issue a statement. You can see that Honorable Minister himself is here. Myself, Honorable Minister of State is here. Other critical stakeholders in the Ministry of Water Resources and Sanitation are all here to tell the public that the news item that was released is false, is unfounded, is untrue, and that news item is already, the signal that was sent, which has gone viral to incite the public on the dangers of this dam, the fear has already been allayed because we are here.
Workers at the dam also confirmed that there is no cause for alarm as the facility is doing just fine.
You can see it with your naked eyes. When we saw it, I saw it yesterday, somebody sent the link. When I opened it, I was shocked. We don't know the source of the information. We don't know the indices they used. But fortunately, the minister stand on his feet. He purposely came here with the state minister. So he showed sign of seriousness. And we here in Upper Benue, we make sure that the operation and maintenance of Dadinkowa is being done efficiently and effectively.
Power plant, we completed 2019 and the operation is 2020. Up to 2020, now we are continuously generating at the full capacity. The dam and the power plant is safe. And this is the raining season. We have to spill the water, whatever the water in the reservoir, we have to discharge it to the spillway. So everything is safe.
The Federal Ministry of Water Resources and Sanitation says it remains committed to serving Nigerians through effective delivery of its constitutional responsibilities, including the management of the nation's water bodies for optimum efficiency.
And that's it on the program for today. Thank you for watching. Join us again, same time next week. I am Bukola. Bye for now.